people look at him and think he's angry or because he has no facial expression whatsoever. Sometimes he gets frustrated when people can't understand him.
Dawson has Mobius syndrome. It means that he's had no facial movement on both sides of his face ever since birth, and he also has the inability to move his eyes laterally out to the sides.
People take it for granted. You can smile when you're happy and frown when you're sad, and he never had that.
Welcome to Good Morning Developmental Disorders. Today we are here to discuss that short clip that you saw in the beginning of this video and about Mobius syndrome. Please welcome our special guest, Emily Beckley.
Hi, Megan, Marnie, Rachel, thank you for having me.
Thank you for coming today. So today we're here to discuss Mobius syndrome. Could you tell us a little bit about it?
Well, Mobius syndrome is a rare congenital neurological disorder that affects the 6th cranial nerve, which controls your eye movements, and the 7th cranial nerve, which controls facial movements. So these two cranial nerves are either underdeveloped or absent when the baby is born. As a result of these cranial nerves being affected, they have a lot of symptoms that we will discuss later today. Some other cranial nerves may be affected, such as the 3rd, 4th, 5th, 9th, 10th, and 12th, and those will result in further impairments.
Okay. So what exactly causes this syndrome?
That's a great question. We don't know. Some researchers believe that it is genetic because there are some sporadic cases of it occurring in families, but there's no conclusive research. But we do know that it is not caused by traumatic accidents that occur during birth, so it is congenital.
Okay. So then, when exactly is this diagnosed?
The infant is diagnosed in the hospital shortly after they're born because they have many difficulties with sucking, feeding, and oral closure.
Okay, so the child's not going home and experiencing these usually?
No, because the doctors would notice the facial issues that the child has, so they need to take care of those right away.
All right, thank you.
Hello, and welcome back to Good Morning Developmental Disorders. We are continuing our discussion of Mobius syndrome. Our next guest will be Miss Marnie Reynolds.
Thank you so much for having me.
Hi, Marnie. So, let's talk a little bit about the prevalence of Mobius syndrome.
So, the exact incidence of Mobius syndrome is unknown. Researchers estimate that the condition affects 1 in 50,000 to 1 in 500,000 newborns, and it affects males and females in equal numbers.
So, are there any other disorders commonly associated with Mobius syndrome?
Yes, comorbidity can be common. Approximately 30% of children with Mobius syndrome are on the autism spectrum. However, this is an issue much debated by researchers because it's hard to diagnose considering the limited eye contact and speech in children with Mobius syndrome, and also those are two common characteristics of autism.
Okay. So it's a little difficult to differentiate.
Yeah.
In addition, Poland syndrome can also be comorbid. Common symptoms of this syndrome include webbed fingers and ipsilateral underdevelopment of fingers, hands, and chest muscles.
Interesting. So, in addition to those symptoms, what are some other common symptoms that are associated with this disorder?
Some common symptoms are lack of facial expression because of weakness or paralysis of the facial muscles, eye problems, impairments of the extremities, hearing impairments, small chin and mouth, hypotonia, ear anomalies, and dental abnormalities.
And are these due to the cranial nerve impact?
Yes, these are all directly related to the cranial nerves impacted.
Okay.
I see. So, do individuals with Mobius syndrome also have intellectual disabilities?
While intellectual disability is possible, it's not common.
So, in addition to, could you tell us a little bit more about some of the eye problems that are associated with Mobius syndrome?
Inability to blink or squint is common. Absence of lateral eye movement, strabismus, and eye sensitivity.
And now strabismus is, could you elaborate a little bit?
That's drooping and crossing of the eyes.
Oh, okay. I see. You also mentioned that these individuals have impairments with their extremities.
Yes. Children with Mobius syndrome are often born with club feet, hand and feet deformities, as well as bone abnormalities.
Thank you. Interesting. Thank you very much, Barney.
And welcome back to Good Morning Developmental Disorders. Our next two guests are aspiring speech-language pathologists Megan Tice and Rachel Hayes. Let's give them a round of applause.
Thank you. We are so happy to be here today.
Oh, thank
you for coming.
Our first question, as we continue to talk about Mobius syndrome, are why are there speech and language impairments associated with this syndrome?
That's a good question, Marnie. So, as our previous speaker, Emily, had discussed a little bit about the cranial nerves, 6 and 7 are impaired, as well as 5, 9, 10, and 12, and they can be affected due to the syndrome. These cranial nerves control muscles of the jaw, tongue, throat, and larynx, and they all contribute to speech production, as well as chewing and swallowing.
So what are the results of these impairments in children?
So as a result of all of those impairments, problems with speech production, so articulation, voice, and resonance are common with individuals with this syndrome.
And what do these impairments lead to?
As a result of those cranial nerves being affected, problems can result with articulation, voice, resonance are common in these individuals. So infants with Mobius syndrome often have difficulty sucking after birth, so the latching to the breast, which leads to difficulties in feeding and swallowing. So their intake of food. Also, individuals can experience cleft palate, or the roof of their mouth may be high or arched, which will also add to these problems with feeding.
Given the state of today's medical technology, there must be something doctors can do to help these infants. Can you tell us a little bit about what can be done to correct these issues?
Yep, so speech-language pathologists will step in with techniques that Rachel's later going to discuss in order to help the child increase motor control of those muscles that are responsible for feeding and swallowing. Another option in order to help repair that cleft palate is corrective surgery, as well as positioning techniques and the use of special nipples to assist with sucking.
Oh, okay. I see.
So, Rachel, you're our expert on therapeutic services. Can you tell us a little bit about these?
Yes, of course. So, the majority of individuals with Mobius syndrome actually have relatively normal language. However, speech clarity is the most prominent issue due to their insufficient lip mobility, which results in poor lip closure and lip rounding. So articulation is very difficult for these individuals. But oral motor therapy is commonly used to address these, and the main goal is increasing normal movement for speeding and speech clarity.
Okay. How would you initiate intervention with these infants?
Very good. So to begin, you must first determine if the muscles of the face and the oral mechanism are fully paralyzed, or if it is simply a sign of paresis.
Okay, so for our viewers, could you elaborate a little bit on what paresis and paralysis is?
Sure. So paralysis would be when there's complete loss of oral motor function, including sensation. So these individuals have no feeling or mobility.
Okay.
In this case, oral motor therapy would then focus on teaching the surrounding muscles to compensate for those muscles that are paralyzed. But in the case of paresis, the muscles are simply weakened. And so, therefore, then the goal of oral motor therapy would be to improve the functioning of these muscles by strengthening them.
Okay, thank you. So, what are some specific oral motor techniques you can use with these infants?
Yes. So, the most successful oral motor exercises are those that address sensory awareness as well as physical awareness to increase the movement of those muscles. Sensory stimulation can be done through use of a lollipop vibrator by sticking it inside their mouth to see if they can feel. Objects then can be used with which the individual can practice blowing, so that's good for lip rounding. So commonly used are toy horns, which they can blow into. There is actually a horn hierarchy in which different horns are used that are increasingly difficult to blow. This strategy works at improving abdominal muscle function, velopharyngeal functioning, as well as jaw, lip, and tongue dissociation. There are 14 horns that can be used, and each also addresses the development of a particular speech sound.
Okay, so it focuses on all of the muscles that are affected
Yes.
in this disorder. Thank you. So I know you brought in a handout for our viewers, so we're going to go ahead and show you that. This is of the horn hierarchy. Thank you for bringing that in for us, Rachel. Are there any other techniques that you can use?
Yes, so the main goal of oral motor therapy is to improve upper lip mobility and closure. Therefore, in addition to the use of horns, you can also use a series of graduated lip closure exercises, and this can be used with a straw hierarchy. With this strategy, 11 different straws can be used to teach coordination necessary for proper sucking and swallowing. This technique also improves jaw stability, lip rounding, and tongue retraction. And I also brought in something to show for that as well.
Okay, viewers, we will send you to the handout. So in summary, we learned today that Mobius syndrome is a rare congenital neurological disorder that primarily affects the 6th and 7th cranial nerves, but it can also affect some additional ones, which lead to further problems.
Some common symptoms include lack of facial expression, eye problems, impairments of the extremities, hearing impairment, hypotonia, ear anomalies, as well as hand and feet deformities.
These impairments and symptoms lead to loss of control of the muscles of the jaw, tongue, throat, and larynx, which all contribute to speech production as well as chewing and swallowing. Individuals may also experience cleft palate, or the roof of their mouth may be high or arched. Corrective surgery can be used to repair the cleft palate, as well as positioning techniques and the use of special nipples to assist with sucking.
The main goal of oral motor therapy is to improve upper lip mobility and closure. Therefore, 2 techniques that are commonly used are the horn hierarchy and the straw hierarchy, both of which improve movement of the upper lip.
All right, so I think we did a good job wrapping up Mobius syndrome, but let's take a look back at Daniel's story.
I mean, the social interactions that they have throughout their life, they learn how to smile without thinking about it.
So it's just a learning experience for him.
Smiles are such beautiful things. They tell you so much about a person. There is no better feeling than seeing a child get their smile back or smile for them.
Thank you for joining us on
Good morning, developmental disorders. See you next